Okay, Soleus, very similar to gastrocs. Because of its broad insertion along the soleal line, we don't friction at the origin, and frictioning for attachment release at the insertion is just the same as gastrocs, either right at the calcaneus or sliding up a little. It can be a little trickier to palpate where that musculotendinous junction is on the soleus because it kind of attaches in around the sides and along the tendon. But sliding like a couple inches up off of the Achilles and choosing to perform your frictions there is an option rather than right off of the calcaneus. A length test for soleus is easy, just bending the knees bilaterally and bringing it into dorsiflexion. Because it's not crossing the knee, it doesn't matter what position the knee is in. Trigger points typically found along medial or lateral to the tendon. I'm trying to palpate and feeling that like cushy, marshmallowy pillowiness, that's the soleus. Usually you're going to have to cross fiber palpate, and it can be hard to get a real distinct sense of anything, but usually you can find some tender areas. They're going to refer similar to the gastrocs into the foot, but the difference with soleus is that it's the referring right onto the heel, whereas gastrocs is referring more onto the plantar surface of the foot. Soleus is more onto the base of the heel. And Travell describes a trigger point lateral to the Achilles tendon, right around this area, that will refer pain to the SI joint as well as the jaw, or the TMJ. You're usually going to use thumb compression, fingertip compression to treat these trigger points. Because it's a tender muscle, it doesn't require the amount of force we need to use with our elbows. You can use your elbows if you'd like, but it's not usually required. Approximation position, she's pretty much in it already. It's full plantar flexion. But palpate, because usually at full plantar flexion you'll feel the soleus engage a little bit again. So backing off a little bit, and like our other muscles, if you're feeling they're not able to relax, adding a little bit of compression directly through the ankle joint to help with that. And to reset soleus is just bringing them through dorsi and plantar flexion. Oh, right, to stretch. To stretch soleus, this is a great position because we want the knee flexed to get gastrocs out of there. And here you can apply pressure down. Usually you need a fair amount of pressure for the person to get any sense of stretch with the soleus. And you can just say, can you please push your foot up into me? 5, 4, 3, 2, 1, and relax. So easy muscle to stretch.